My name is Rajan Patel. I'm a surgeon, head and neck surgeon, and I'm the clinical director of the Mercy Ascot Head and Neck Service. World Head and Neck Cancer Day is really an initiative to increase both public and other medical professionals' awareness of head and neck cancer. And really the premise of the initiative is to increase access of these patients to appropriate services at an earlier stage in their head and neck cancer journey, because many of these patients can be cured if they're treated early. Head and neck cancer is a relatively common cancer worldwide. It's the 6th most common cancer. The cancer typically affects men more than women, and particularly in the age 50 and over. There are several risk factors for head and neck cancer, and they include UV or sun exposure, which relates primarily to skin cancer, melanoma, but there's also smoking, heavy alcohol intake, and HPV, human papillomavirus. Human papillomavirus exposure is increasing dramatically, and so we're actually seeing an increase in the incidence, particularly of throat cancers, over the past decade or two, and that relates primarily to HPV, human papillomavirus. The presenting symptoms or signs associated with the head and neck cancer are quite common. So, for example, a sore throat or a change in the voice, a GP would see commonly in their practice day to day, week to week, but a very small number of those patients would have a sinister head and neck cancer diagnosis associated with that symptom. It's quite difficult for particularly a GP without the equipment that we have here in this clinic to access those body sites to inspect whether that symptom or sign is caused by a cancer or some other cause. So there are several red flags that GPs and other referrers should be considering when they see patients with a potential head and neck cancer, and they include a new neck clump that persists for 3 or more weeks, any changes in the mouth such as oral ulcers or swellings or white or red patches that persist for more than 3 weeks, change in the voice, difficulty swallowing, one-sided nasal block or obstruction, or one-sided ear pain with a normal ear examination. So we know that delay in diagnosis of head and neck cancer can disadvantage a patient because it can reduce their cure rate and also can increase morbidity, because if they have a larger cancer they may need larger treatment, which can be associated with more significant functional deficits. So we would urge GPs to consider immediate referral of any patient with a red flag symptom or sign to a specialist for further assessment. So the Mercy Ascot Head and Neck Service is a very unique proposition in New Zealand in terms of its value to patients and referrers. So we essentially have a multidisciplinary team. We've got surgeons, radiation oncologists, medical oncologists, head and neck radiologists, pathologists, physiotherapists, specialist head and neck cancer nurses and dietitians, and there's some other people also involved in that team. So what this means for a patient is that they have immediate access to all of the services that they may need on their head and neck cancer journey. Our head and neck service also includes a neck lump clinic, which is basically a multidisciplinary clinic where a patient has access to a radiologist, a pathologist, and a surgeon at that one clinic appointment. And so what this allows the patient is it avoids many of the delays that are associated with patients being investigated for a neck lump, because typically they'll need to attend multiple appointments over perhaps a week or 2 or maybe even longer. And so you can imagine that the journey for that patient just to establish a diagnosis would be reasonably long compared to a 45-minute appointment. So another innovative proposition that Mercy Ascot Head and Neck Service offers is that we have a patient support group for head and neck cancer patients. So this is basically a group of patients who've been through the journey who can offer help to each other and also to new patients who are starting their journey. GPs have a challenging role in assessing patients with head and neck cancer, and I'm sure other body sites. And so my message to GPs is, if they're concerned at all, they can message us or phone us, and we'll be more than happy to provide advice. As we've said, if there are patients presenting with any of the symptoms or signs that are red flags, then again, a referral to our service would be beneficial to their patient.